Good afternoon and welcome to today's Ask the Experts webinar from SimplePractice, a collaborative look at cancer care. We are honored to have you with us this afternoon. We've got a great panel of experts to talk about their work across disciplines. We'll be together for about an hour today. And just as a reminder, there will be a recording of this webinar that is sent out within the next 24 hours after we've concluded this afternoon. I'm Ben Caldwell. I'm the Education Director here for SimplePractice Learning. I'll be the facilitator of our conversation today. And we'll spend a couple of minutes starting with introductions of our panelists. We'll get into some pre-submitted questions that our panelists have a lot to say about. And then we'll close with some final thoughts before the hour. To start with, let's introduce our speakers. We have Allison Tierney. Allison is a registered dietitian and board certified in oncology nutrition. She's multi-passionate in nutrition. Her expertise goes beyond cancer and involves helping others with the management of chronic diseases with a focus on a whole food, plant-based diet. Allison, we're happy to have you with us. You want to talk a little bit about your work?
Thanks so much. Yeah, I'm super happy to be here and among the other panel experts as well. So my work currently is in my own private practice of Wholesome LLC. And previous to that experience, I was at two different cancer centers, one nationally well known and then one a more local academic center. And when I transitioned to the local academic center, we built the nutrition program from the ground up to where it exists now, which is something that's really cool because I got to see that insight and be able to build where there was no pre-existing nutrition cancer center program. So that's really cool from that standpoint, and to be able to collaborate with other disciplines to figure out how is nutrition care going to work in together with the already existing program. So I still do some work at that cancer center, but then I do the biggest amount of work in my own private practice, where I see primarily cancer patients, whether they're going through the course of treatment or they're actually into survivorship as well, and how we can help reduce their risk of recurrence using diet, nutrition, and healthy lifestyle. So that's kind of where I'm at right now.
Wonderful. Thank you, Allison. Next, we have Emily Roll. Emily provides in-home speech therapy services in Houston. Emily has a specific interest in treating adults with dysphagia secondary to a variety of etiologies, including cancer. Emily is passionate about evidence-based treatment and patient education. Emily, you want to talk briefly about your work?
Yeah, sure. So I have experience treating patients with head and neck cancer and other cancers in the home health industry and at the hospital. I still work PRN at some local hospitals, but then the majority of my work is through my private practice. So typically I get patients that might have voice or swallowing difficulties, either not usually immediately, but some point later on, whether that be like 3 to 6 months after treatment when some of their difficulties have set in. So yeah, it's an area that I enjoy, and I'm happy to get to be a panelist here.
Great, thank you very much, Emily. We're happy to have you with us. Then we have Caitlin Minier. Caitlin is a mental health clinician in Seattle with a passion for helping people understand and cope with the myriad of mental health issues associated with chronic illness. She works with both patients and caregivers as they navigate the medical world and the sacred work of making meaning out of a serious or life-changing diagnosis. Caitlin, you want to talk briefly about your work?
Yes, thanks, Ben. Hi, everybody. I am definitely a relational therapist, so I help. My work right now is within a group practice, and I work with adults across the lifespan, developing and really understanding their sense of self, how that identity shifts when it comes into contact with trauma or grief or chronic illness. In my previous work, I was within a cancer center, so an integrated healthcare center, working with oncology patients, either with an active diagnosis of cancer or within or in the post phase, the survivorship phase, and really working with them to understand how their identity has shifted. And to really make meaning out of and just the chaos that can come out of a cancer treatment. This work is really near and dear to my heart, so I'm grateful to be here today.
Thank you so much, Caitlin. We're very lucky to have all of you here with us. This should be an interesting cross-disciplinary discussion today. with that, let's dive right into our questions. The first one comes from Brooke. And Brooke asks, tell me about your work with families and support systems. This is a question to everybody. So Caitlin, why don't we start with you, and then Emily, and then Allison.
Okay. Yeah, it's a great question. And in all of my work, I try really hard to use all of the support systems around my clients to help them reach their treatment goals, to find the support, and to really find healing in those relationships. And I believe with cancer care, often the support systems, the spouses, the children, the extended family can often be overlooked. All of the focus will go to the patient. And so my work with caregivers is often to provide them support to help them have a space to explore those harder emotions that come with taking on maybe the brunt of parenting, the brunt of being maybe the main breadwinner now, and really helping them to express that. You can see a lot of distress in couple systems when one partner is undergoing treatment, and that has a lot to do with just the shock of the emotions and just the fear with, having a spouse or a partner that is going through such an incredible treatment. And so providing couple counseling to help support them in that, as well as parenting. And I think it's important to note that kids are going to all act differently in terms of who has the diagnosis. So if it's a parent, if it's a sibling, if it's a grandparent, you're going to see shifts in their behavior. So it's expected that they might not do well at school, that they might act out, and that's just their way of processing, not having the right tools. So I believe that family sessions are incredible, even if it's just to break down what cancer treatment might mean to them in smaller terms. And yeah, I believe holistic care is really attacking the whole family and holding them through the experience in whatever way they need.
That's great, thank you. Yeah, certainly a cancer diagnosis is a family event as well as an individual medical condition. Emily, tell us about your work with families and support systems.
Yeah, so kind of like what Caitlin said, each patient and family vary in their individual needs, and it also depends on where they are with their treatment. Those needs are going to be very different coming into it, just getting diagnosed, and then as they're going through it, and then afterwards as well, into that survivorship like they were talking about earlier. I find that families are very supportive when it comes to my treatment recommendations and diet modifications, and that burden might be harder on individuals who don't have someone close by to help. Specifically head and neck cancer, it's devastating. You can have your teeth extracted, you can maybe lose your voice or have voice problems, swallowing problems. And so what I see a lot of the times is that, so much of our quality of life, our livelihood, our social aspects involve, using our voice, communicating to our loved ones, eating and drinking around meal times or at work or, for happy hours. So there's definitely a lot there. And so I would say that SLPs should have resources available to patients and family members should they want it. I try to keep an updated referral list for counselors and support groups to refer my patients to. So, they might not be ready for it, but at least they know it's there. And I have patients that maybe immediately are like, yes, I want to talk to someone, or I want to be involved with this group. And I have other patients that, might come back to me later and be like, yeah, you know what, like you had mentioned that some people benefited from this. So helping them build their support system through referrals too.
It kind of reminds me, we did an Ask the Experts webinar not too long ago about working with military populations. And I remember one of the points of emphasis with military populations is that you don't force anybody to a particular type of treatment or particular referral, but you let them know what resources are available to them, so that
Exactly.
people can sort of, when they are ready, make use of the resources that feel most relevant to them. This sounds like a close parallel.
Mm-hmm. Exactly.
Allison, what about you? Tell us about your work with families and support systems.
Yeah, I absolutely love hearing from Emily and Caitlin, because even though we're in different disciplines, it is kind of a similar thing. And I think we can all relate across the board that it's a very individualized approach. And knowing their families and their support system is really important for their own individual care. So for example, it does differ for me, especially when that individual is in treatment versus maybe into survivorship. And so when they're in treatment in particular, especially as it relates to, like, for example, fatigue, which is the #1 side effect related to cancer treatment across the board. You know, fatigue, one of the biggest things that's going to affect their eating is that they have the energy to be able to cook a meal, right? And if they don't, do they have a support system around them, someone that lives with them, whether it be a spouse, a family member, to help them cook a meal? That's super important to be able to understand. But if that individual lives by themselves, they don't particularly have that support, then we have to work around that. Okay, what can we do to help this individual be able to make sure that they have meals available to them, and easy access, so that they are eating, they are getting their nutrition. So that definitely plays a huge role. And as you can imagine, some families are more involved than others. And I think Caitlin had mentioned this too, and I know it applies to Emily, but when you kind of have those family sessions, I love when the whole family, or even just part of the family, is there, so that we can kind of like get an idea of what is happening at home versus, you know, sometimes the patient likes to exaggerate a little bit about maybe how much they are actually eating or not. So it's nice to hear a little bit of both sides, so that we can really put together what that bigger picture is. Now, into survivorship, for a little bit of a different example, I'm working with a lot of individuals who are looking to just improve their nutrition and overall healthy lifestyle to reduce their risk of development of cancer. And I have a lot of individuals who say, you know, my spouse is not on board with this, or they might have kids and my kids are picky eaters. And I often have to talk to people about how, and remind them that the people around you and how they're eating, especially kids, can drastically influence how you eat as well, right? So if you have kids at the table and they're picky eaters, you get a little bit of frustrated maybe in how that works, and sometimes you just have to you just go, okay, whatever, right? And so even with like the moms that I'm working with, or the dads or anything, sometimes we're talking about pediatric nutrition, so that can help them improve their own relationship with food at the table. So one of my patients just yesterday, we were talking about how to feed her kids, because it was truly affecting how she ate her meals too. So it is that that whole person approach in terms of, you know, what does this individual have for them, going for them, and sometimes going against them, right? You know, and you kind of mentioned in one of my bios that I focus on a plant-based diet, and it doesn't mean that I work with people only plant-based by any means, but oftentimes people will say like, but my husband wants to eat a ton of meat. And it's like, well, we didn't say that you couldn't have meat or anything like that, right? And so it's kind of hitting some of those objections of, well, the biggest barrier for me to make these changes is my family or whatnot. So taking all of that into account is super important. And it's amazing, the support system, in terms of how it can benefit or really hurt somebody too in their progress.
Absolutely. Thank you. And it's kind of a nice segue into the next question, because, you know, when you're talking about what people are doing nutritionally, you know, certainly since the pandemic, people's habits have changed, their behaviors have changed. And sometimes people who were not ever at home for dinner are home for dinner now every night of the week. So it's had an impact on family dynamics, certainly had an impact on people's nutrition behavior. Our next question here is, how have each of you pivoted your work during COVID to still provide care? Allison, I'll start with you just to kind of follow up on that topic here, and then we'll go Emily and then Caitlin.
Yeah, absolutely. Yeah, food has totally changed for a lot of people. You know, kind of how it relates to how we help that individual. The other thing that I need to take into account is, where does that individual live, right? What access to food do they have? What availability? we were talking about this earlier with the panels. I live in Milwaukee, Wisconsin, where it's 18 degrees today and it's really cold out. And I live in more of, not a rural area, but that definitely affects where people can get certain foods and certain availability. Where for the other people that, you know, I know that live in California, they have way more options and availability to them depending on where they are. So that has made a bigger impact in people in terms of their nutrition and their food choices based on where they live and what's available to them with COVID especially. I feel like COVID has made a bigger impact in that. And then you do find that people are eating at home more, and some people are like, I hate to cook. What do I do? And so now I'm getting bored of these meals because maybe we've been eating at home for so much longer. So it's really being creative and then encouraging the patient to be creative at the same time, but you have to help them through that process. Sometimes, people often think that, really good nutrition, you have to have this like amazing recipe that you put together. So sometimes it's just telling people that you can keep it simple and it can still be delicious and it can still be nutritious and help you meet your goals, whether that be during the course of treatment or into survivorship. The other thing that we sometimes take a little bit more advantage of right now is some of the home delivery services in terms of meals. If somebody is having that fatigue or those issues, if they can get a meal that's already cooked and delivered to them, or the ones that they kind of come with the ingredients and you only do a little bit of cooking, we try to take advantage of those if the individual has access and ability to be able to choose those types of products. Now, otherwise, like in my practice, we're definitely doing everything virtually. In a way, it has actually helped a little bit because when I'm seeing a patient virtually, most of the time they're at home. And sometimes they'll be sitting in their kitchen and I'll be talking about certain things that they have. And they're like, oh, let me go get that and show that to you. And I'm like, this is perfect. So I get to see what they're actually talking about. So there have been some really great advantages from that standpoint of COVID. But although I would say that our thought process is still similar, we just have to think about it differently for families and what access they have and so forth. So yeah, so it has impacted, but in a way it's almost a good impact for us because people are eating at home more.
That makes sense. Emily, what about you? Have you pivoted during COVID?
Yeah, so as an SLP, I had never provided teletherapy, so I had to learn pretty quickly about all the different platforms and staying HIPAA compliant and all that fun stuff. But yeah, COVID made teletherapy happen rather quickly for my practice. But I did continue to see patients in their homes, kind of like what Allison talked about. Not all of my patients have like a webcam and Wi-Fi. So, as much as it can make access to care easier, not necessarily for everybody. But I've also had to get really creative in the home, not just on teletherapy with how I provide therapy, especially when I have a mask and I may be trying to work with someone on their speech, their voice, or their swallowing, voice therapy. We're often, using tools we have to put into our mouths, which can't really do that anymore. Or I might be eating with the patient. Now I have a mask on. I did buy clear masks, but I only use them with some of my patients, but I still can't like touch my mouth or I'll forget I'm like, hitting my mask. So I think overall just had to get really creative with how I do my therapy, whether that be online or in person. I'll say one win that kind of like similar to Allison, I felt like maybe made me a better clinician is I have been trying to get better at the coaching model rather than like, okay, here I'm coming into your home and I'm going to do this for you. And with teletherapy, since I can't be there, that coaching has I've gotten better at that. So it's made me a better clinician in that way.
That makes sense. Caitlin, you and I are both family therapists. And as Allison was saying, it's been, in the time of COVID, interesting that you maybe have more of a window into people's homes than you otherwise might doing in-person services. So there's been maybe some level of advantage here. But how have you pivoted in the time of COVID here to continue providing care?
Yeah, I think I agree with everybody that COVID hasn't been fun, but there has been a slight advantage to providing telehealth to people that are perhaps it's harder for them to commute all of the time. And in the context of cancer, I can see my cancellation rates and my no-show rates have kind of dropped in that case because in the past, cancer care comes with so many appointments. You're spending several hours a day in different places with different specialists, just really caring for your body and trying to fight this. And so when you look at physical health and mental health, if you have to choose between one, mental health is probably going to be the one that you cancel. And so it's been interesting being able to provide more like flexibility in terms of hours, in terms of, you know, some people just do not have the energy in their day to drive across town to come to your office. And I believe that providing mental health care for this part of your life is so important. So it's been kind of incredible to be able to provide more hours for people, you know, maybe like really early hours or late hours where they don't have to commute and where I can see them in their home. And the benefit from that is that they're not having to commute. They're not even having to walk across the parking lot, which sounds silly, but is sometimes really hard for people to do, to get up the stairs to come see you. So sometimes I can just see people at home in their most comfy chair in their bed where, you know, maybe they are eating, maybe they are doing something like that, you know, they're actively taking care of themselves, and we get to meet and we get to work on the mental health aspect of it. So it's been really nice. And again, with the family sessions, it enables more people to come. You know, we don't have to have so many corresponding schedules to get all the kids in, or to get the spouse in, or to get, you know, the extended family. It's like we can have everybody that's available in the house sit around you in your bed or your favorite chair, and we can talk about the kind of things that would help your mental health, talk about the lifestyle changes that everybody can participate in, such as diet, such as, you know, those OT exercises. So I've appreciated it in that sense.
Yeah, it makes sense. Our next question comes from Whitney, and it's for Allison. Why is nutrition not a more popular treatment for cancer, or a preventive strategy for that matter?
Yeah, that is a really good question. And it is definitely multifactorial. There's lots of reasons behind that, in my professional opinion. And I think part of it is that there's just a lack of education about what dietitians can do and what they can help with. And, you know, even in my opinion, I think even the other disciplines that are here, like SLPs and mental health therapists, sometimes we don't actually understand what they can do to help our patients as well. And we'll talk about that interdisciplinary approach, but I think sometimes it's just a lack of education, whether it is to the other providers or to the patients. And so, for example, at the cancer center, when someone's in treatment, they would get a referral to the dietitian, and then they have the ability to decline my services or not. And then with that being said, I would go and see a patient, and sometimes I would hear them say like, I know that fruits and vegetables are good for me. I just really don't want to talk about that right now. And to have to describe to them like, yes, I understand that dietitians love fruits and vegetables, we do. However, but in cancer care, it's a very different approach, because if somebody is having bowel changes, if they have food aversions, and all these other things that could be going on, most of the time we're actually not recommending fruits and vegetables and those types of things, or we're going to provide them in different recommendations. So I think sometimes it's the mindset of what a dietitian is and what a dietitian does. But just like so many other disciplines, there are so many different types of dietitians, right? There are some that are maybe weight loss dietitians or renal dietitians. Our role as oncology dietitians is truly to help somebody improve their quality of life, be able to tolerate more food as they go throughout the course of treatment. So I think it's sometimes that misconception of what people think dietitians are for. But when it comes to the preventative side of things, we actually do know from research that, you know, having a healthy diet and other lifestyle factors around that, because although I'm a dietitian and I'm a food nerd, 100%, I love all the research about it, I'm a big believer that there's so many other pillars of health, just like mental health, physical activity, all of these other things that come with it. And I think sometimes it's often forgotten that the things that we do at least 3 times a day, choose the foods that we're eating, actually have such a huge impact in our role of disease. And again, sometimes that comes from education. You know, I have some people that come to me that have very good knowledge already about how food can either positively or negatively impact a chronic disease. And then I have some people that have not the slightest clue that food plays any role in the development. So for example, most people are very familiar that smoking can be something that drastically increases one's risk of lung cancer and other types of cancer. But research shows that only a third of cancer deaths are related to smoking, whereas there is actually a third of cancer deaths are actually related to diet, healthy lifestyle, and overall lifestyle as well. So I think oftentimes there's some things that are very obvious, like cancer or like smoking, about the preventative side, but there's not enough education going around about how we can actually do things in our life every day, or just try to improve, that can help reduce our risk of developing cancer and its recurrence. And so, I'll be the first to tell you that, someone unfortunately could have a perfect diet, they could have perfect physical activity. And I don't even like to use the word perfect because I don't think anybody is. I don't have a perfect diet. But when we really strive to do all the right things, there's still a possibility that we can develop cancer. So it's a matter of trying to educate people of the things that are in your control versus the things that are not necessarily in your control, to see how we can reduce your risk over time to help. So I think there's more situations other than that, but I think the education and just like the lack of understanding of what dietitians do, and the availability of research related to nutrition is something that's really important. And I do think, somewhat unfortunate, but I also understand it. In medical school, physicians it's not even a requirement to have a nutrition course in medical school. Whereas dietitians, most of us all have master's degrees. We have an undergrad in nutrition. We've been studying nutrition and just nutrition for so long, but yet many people still find that their physician is their primary source of nutrition education, when most physicians unfortunately aren't educated in nutrition. And I don't necessarily blame it on that. I think it's more of the fact, like, they're excellent diagnosticians and treatments and stuff. So it's kind of, again, using that interdisciplinary team appropriately to help, really focus on that whole person. So hopefully that helps.
Yeah, that's really interesting. So it sounds kind of like, for at least some of the folks who either do or would see a nutritionist, there's this reluctance out of the expectation. It's almost going to be like going back to childhood and having that unpleasant experience of hearing over and over again, eat your vegetables, eat your vegetables. It sounds like that's what some people expect out of visiting a nutritionist. And you're saying, well, it's not really like that. That's not the only thing that we recommend.
Yeah, absolutely. And I think the other thing too is, like, in overweight and obesity, some people think we're just going to come and tell them that they need to lose weight, but that's not the case at all. We actually want them to maintain their weight during the course of treatment, because that improves tolerance of treatment. So I think it's those expectations. And I do think some of it, just kind of like you said, Ben, like where you go back to your childhood, or maybe people go back to, either current experiences or past experience when it comes to their weight or their lifestyle, that they don't want to be negatively talked about those choices, when really we don't focus on it like that. We figure out, okay, what can we do now to help you improve, and go from there. So I think that's what's really hard, is people just have that thought process of what a dietitian does. And honestly, before I was a dietitian, I didn't realize all the different avenues and like types of dietitians that there could be.
Well, and you all have talked about the need for care to be kind of coordinated. So that takes us to our next question, which comes from Paula. How important is working with other specialties and backgrounds when working with cancer patients? And when should you refer to those particular specialties? Caitlin, I'll start with you here, and then Allison, then Emily.
Okay, it's a really good question, and I think the ease with which you refer to other specialties is kind of based on the setting that you're in. So, if you're within like a cancer center or an integrated healthcare place, usually the referrals are around you, and it's a little easier. Everyone's using the same EHR system. You can consult, you can like walk next door, and it's easier that way. But it's also very doable if you're in private practice. It just takes a little more legwork, but it's really important. It really enables. It's kind of like building the care team. I like to think of it like a superhero team. Like, we all have like different powers and different focuses. And what that does for the patient is it really enables them to focus on different parts of their health: mental health, physical health, diet. I really love referring to music therapists and art therapists, because it's such a different way to interact with the experience of illness. Like, you can look at it a different way. And we're not just talking about anxiety or depression or pain. We're thinking about creativity. We're thinking about seeking relaxation and calmness in a different way. So I love that. I think the referral that I use the most would be dietitians. I think it's incredibly important to nourish yourself. And so I love everything that you're saying, Allison. It's just, I see a lot of resistance there too. So I understand exactly what you're saying. But it's something that I use. And I also, I consult with medication prescribers. I think it's really important to be able to understand the side effects and the combinations with oncology medications, as well as like antidepressants or anxiety medication, and how that presents in your client. And I think the other part of it is not just referring out, but being able to consult between people is the best way to talk about how your client's presenting, to bring in your client's culture, the beliefs, and really how they're interacting with their illness, so that everybody's kind of on the same, got the same perspective, and we can support the client or the patient in the best way that brings in their knowledge, leveraging their knowledge, their values, and using all of those resources that they already have within them. So very important to answer that question. Yeah,
absolutely. Allison, I might ask you to focus on the last part here. When should you refer to those specialties? I think this is it's not just a challenge within cancer care. It's a challenge in a lot of other sort of areas of health and wellness care as well, that you as a practitioner might have a good, clear sense of the other kinds of disciplines and specialties that might be helpful to this client. But it's a different thing knowing that versus convincing the client to go and being proactive in making those referrals versus kind of waiting for the client to bring up a particular need. How do you draw that distinction? When do you make those kinds of referrals, or is it just automatic?
Yeah, no, the referrals for me are not automatic. And I think it kind of, because, just from that individual approach, I think it was Emily who mentioned that like cancer patients have so many different types, so many appointments, right? So like, we don't want to overload them in terms of appointments and so forth. But what's actually interesting is I refer to mental health very frequently in my private practice, and SLPs primarily with my head and neck cancer type patients, and for the most part. And now when it comes to mental health, and when I think that it's a proper referral, it's just based on talking to that individual. Now, I think actually something that's really helpful, to be transparent, is that my own personal experience with mental health therapists has been something that's been eye-opening for me, for my patients. And I think it's getting an understanding of what they truly do and what they can truly help with. So for example, there was a patient who was kind of interested in working with nutrition, but kind of talked a little bit about that she has kind of a severe history of emotional abuse in her childhood that drastically affects her eating and her emotional eating. And when I talked to her a little bit about it more, it's really important to know, like, can I actually, as the dietitian, help this patient move beyond her food addiction type, if she hasn't had seen a specialist for her mental health portion of it. Because I have seen a couple patients before where I just see that block and that barrier, that their mental health is blocking them from being able to be successful in their nutrition. So I think it's a very much understanding that you have to be able to have that relationship with the patient where you get to know them, you kind of understand what are those things that are going on for that individual, and then know that it's time to refer if you can't help them anymore. And I think one of the biggest pieces of that, whether it be a mental health therapist, an SLP, a physical therapist, you name it, knowing what those people do in their role and how they can help their patients is super important. And I think that's one of the best things that has helped me in my career and in my practice, is just really taking the time to learn what other providers do. For example, I work with a lot of females, and they'll have questions to me about maybe their bladder and like issues that they're having there. And my experience working with physical therapists is like, this is not, after I address the nutrition part of it, I can say, this isn't a nutrition problem, this is a pelvic floor or a PT issue. We need to make a proper referral. But without truly understanding what those providers do, I would never know when to make that referral. And we used to have a program in our cancer center It no longer exists, but it was a program that was specifically designed for teaching people how physical therapists can help your cancer patients and when to make the proper referral. So we had training in it, and I personally seek out, hey, what do you do? How can you help my patients? And just building that network, especially in private practice, and knowing now with COVID and how our practices often work, you know, I have the blessing to be able to work with people across the country, where if I know that I need specific Wisconsin people or specific states, I need to know how that discipline works for those people too. So does that help answer that question?
Absolutely, yeah, thank you. Emily, what about you? How do you draw the line is a weird way to put it, but how do you distinguish between when a referral is necessary, when it's going to be offered, versus those times when you might kind of wait for the client to be more, or the patient to be more ready?
Yeah, so I think Caitlin said it really well with like, you know, it really depends on like where you're getting this patient at. You know, for my practice, I'm really not seeing patients right at the onset of diagnosis. Like they are probably going to MD Anderson. But for those SLPs that maybe are in these more rural areas where there's not a cancer center and they can't commute there, I mean, I have had that before where I am seeing the patient in home health and they're not going to that cancer center. So if this patient's just beginning on their journey, I would say yes. Like it's going to be very, very important for them to get, you know, that initial referral to the dietitian, that initial referral to behavioral health. Like you should try to build that team early on, maybe not necessarily later when they're you know, beat their cancer and right now we're just dealing with like a swallowing problem because of fibrosis. That might just be like, you know, as the symptoms come up. But I think, yeah, it's really important to collaborate with members of the team. You know, especially if it's early onset, you're going to want to make sure that you get the medical records, if you see them in their home, like from the oncologist or PCP, to understand like what kind of cancer that they have, because that's going to impact your treatment plan. So that's like the most important thing. But, you know, you might make referrals to a certified lymphedema therapist. You might make referrals to the dietitian, behavioral health, and so forth. So like I have a couple examples, you know, before like I've worked with counselors and they might have told me that a patient didn't or had a little bit of anxiety because she didn't understand exactly why I was telling her something. And so then I'm able to go back to that patient and make sure that I explain that to her in a way that she understands. Or maybe the dietitian might inform me that, you know, my patient isn't meeting their nutrition and hydration by mouth anymore because they're avoiding swallowing, but maybe the patient didn't feel comfortable telling me because they know that prophylactic swallowing for head and neck cancer is so important. And so it's kind of, and I know Allison talked about that, that's why it's so important that we talk and communicate with each other so that way we can get the full picture about what's going on with our patients.
Yeah, that makes a lot of sense. And our, excuse me, our next question, Emily, also comes to you. It is from Arjun, who says, for those of us in speech language, I assume that means speech and language pathology, how do we get started working with cancer patients? So for somebody who's in the field, but maybe has been more used to working with other kinds of clientele, really interested in helping cancer patients, what's the pathway in?
Yeah, so later on we have some questions where where we're going to get into like special recommendations for trainings. So I'll hold off on that. But the most important thing, and this is with anything that we decide to specialize in, is you have to build your competency first. So, you know, taking those courses and, you know, that way, whenever you speak to other members of the team, you'll earn their respect and referrals when it's clear that you understand why you're making the recommendations and referrals for your patients. Once you build that competency, you know, at that point you can provide in-services to doctors' offices, you know, reach out to the nearest cancer center and let them know about the services you provide, especially if there's a speech pathologist that works there. You know, you can speak with him or her to discuss your trainings, and they can maybe refer patients to you that can't commute to that cancer center. And once providers see and hear about your results, you know, your business will grow from there. But yeah.
So it's a matter of building your skill set as well as once you have that competency in place, kind of building your network among this population.
Exactly.
Cool. Thank you. Allison, our next question is to you. It comes from Wayne, who asks, what positive outcomes can cancer patients see from working with a dietitian or nutritionist?
Yeah, this is such a great question. So of course, I believe there's so many great benefits, right? But science, I'm a big evidence-based individual, and what does the research say? Now, when we're talking more specifically about cancer patients going throughout the course of treatment, what we really do see in terms of improvement is that nutrition intervention with cancer treatment can help reduce side effects related to treatment. So for example, if an individual, a certain type of cancer treatment is known to cause mucositis or mouth sores, what are things that the dietitian can do to help complement some of the other things that are being done in medical oncology or radiation oncology to help reduce that mucositis or mouth sore so that the patient can eat better. So another example that I've given people too is that let's say someone has diarrhea during the course of treatment. Now we know that that can result in loss of nutrients, dehydration, etc. And sometimes that can result someone be going inpatient, which most people do not want to have to do, right? So I always encourage people, like, if I can help you make the right food choices, the right hydration choices, that we can help reduce your diarrhea, get back to normal, and prevent inpatient stays. The patients are all for that. And we also know that nutrition can really help prevent weight loss and malnutrition. Unfortunately, malnutrition, depending on the cancer site and the type of the cancer site and the type of treatment they're undergoing, malnutrition can be more possible with a certain type. So like head and neck cancer treatment patients, for example, they're at much higher risk related to what malnutrition risk. And in fact, like 40% of individuals that have cancer that are going into their cancer treatment might already present malnourished. And malnourishment can reduce, it can worsen side effects, but it can also reduce the amount of treatments that patient is able to get. So our goal is also to help patients be able to complete their treatment protocol at the dose that it's recommended for them, because anytime we reduce those doses or have pauses in doses can reduce the prognosis or the ability for that treatment to be able to be effective. We also see fewer hospitalizations, as I mentioned before, and just overall like improved quality of life. And if I can explain that even to a patient, like, we're here to help you, live better throughout this course of treatment. It may not be a breeze by any means, but if we can help make you feel better, help you participate in what we would consider normal life activities as much as possible, then that's a huge win. And I think about that, from personal experience. My mom is a breast cancer survivor, and she just wanted to be as normal as possible. And nutrition can help that process and that patient. When it gets into survivorship and so forth, it's a totally different game, but it's very similar. We can help let people live better quality of lives, improve their energy, how they feel, reduce the risk of recurrence. There's a lot of great things that can be done in both avenues of nutrition when working with cancer patients.
That was a fantastic 60-second or so sales pitch.
Yeah, good. I'm glad, because everybody should see a dietitian, I think, during the course of treatment.
Our next question comes to Caitlin. It's from Ellen, who asks, what are some of the most effective behavioral health interventions to use with this population?
I think it just reminds me of everything Allison was saying about improving quality of life. And that's kind of where most of my behavioral interventions come from, is first of all, how do we understand what the meaning of cancer is for you, and how do we improve your quality of life? How do we increase your cooperation with treatment and just get you through that, so that we can take care of the other aspects of your life? So I think the most useful one is motivational interviewing. And it goes kind of well in the setting, because that's what physicians usually use, is when they give you lifestyle changes, diet changes, and treatment regimens. They often use MI when they're talking about how to implement this into your life. And so I use it with clients when they come in and they are experiencing resistance or resentment, or are just feeling unheard. So how do we break down these lifestyle changes into smaller chunks and connect it to their values? and their motivation to live better and to improve their quality of life. So I find that really effective. I also use a lot of mindfulness and meditation. Using like 2 to 3 minutes of mindfulness at the beginning of a session creates kind of a different atmosphere for patients. You know, a lot of their appointments are hectic or painful or uncomfortable. And so creating that kind of ritual at the beginning of the session gives them just like a sense of calm. It also enables them to use that practice at home. So if you consistently do it in each session, it enables them to take mindfulness or small moments of meditation and be able to use it at home, where they can use it when they can't sleep, when they're feeling really anxious, or even when they're experiencing a lot of pain. Being able to use muscle relaxation to ground themselves can be useful, and even in the hospital setting when they're sitting there getting a treatment, being able to pull on those skills that you practice in session is really useful. When I first get to know patients, I use something called an illness story. And it's basically an intervention of learning about how they have learned about illness and how that is in their family. So we basically make a genogram, extend it out about 3 generations, and we just track illness in there. And that includes mental and physical illness. And we just track who had what, who had depression, where did diabetes pop up, did anybody have cancer, how did people, you know, what were the deaths that were strange in your family. And we track it, and then we can also connect where the messages came from. So if you experienced your grandfather having cancer, what was that experience like for you as an 8-year-old? And how do you see that now that you have cancer? How does your spirituality fit into that? You know, where are your beliefs on the meaning of life, on quality of life, and how does that fit into this whole story? And it's a wonderful tool to help people not only understand their story, but to reframe their story, to really understand who they were before the diagnosis and what this means for them now. It helps them cope with the changing of roles and responsibilities that happen, especially when they're in treatment, when they kind of have to let go of some of those things that brought them strength, such as their job, such as being, you know, a parent. Sometimes they have to let go of that, and that can be really painful. So how do we restory that in a way that brings them strength and uses really their strengths and their values? And then I think emotion-focused therapy is incredibly helpful for couple distress as well as parent-child distress. So I use that with family sessions. I use that especially with couples. Something that is overlooked is often, and especially I think in breast cancer survivors, is the changing of sexuality and the body. And so in couples, this can cause a huge risk. So using emotion-focused therapy and really helping each person within the system understand their experience and express their experience can be just so beautiful in helping people understand how they're changing and who they're going to be and who they want to be. Yeah, I hope that answered your question.
Yeah, that's great. There are a number of really good suggestions there. I particularly like the attention to how patients and their families are making meaning of the diagnosis and the treatment and the transitions in their families that are happening as a result. That's great. Our next question, I think, Allison, you already answered this one, so I'm going to skip this one and go to the training question, because I'd like to hear from everybody on this one before we run out of time. Do you recommend any special trainings for those wanting to work with cancer patients? Allison, I'll start with you, and then Caitlin, and then Emily.
Sure, absolutely. It is, so at least in the field of nutrition and dietetics, it kind of depends on where somebody is in their path to becoming a dietitian, or how long they may have already been a dietitian for. So for example, I actually went back to school to become a dietitian after a different degree and career, and I went for the purpose of wanting to be an oncology dietitian. So when I went to school, I told my advisors and my professors, like, I want every experience possible in oncology, because oncology nutrition, unfortunately, it actually is it is definitely a specialty where there's not that many of us. So I wanted to get that right on the books, like, this is what I want to do, I'll take any experience. And then I was actually willing to drive for that experience too during school, so that helped. So getting every experience possible, especially if you're still in that path of becoming a dietitian. But to be honest, a lot of my learning in oncology was actually trained. So we have, if someone specifically is a dietitian, there is a book from the Academy of Nutrition and Dietetics that's called Oncology Nutrition for Clinical Practice. And that's available to really anybody but dietitians it's focused on. And I kind of just studied that book back and front and was able to thankfully be in an internship with oncology and then also transition into an outpatient oncology dietitian right from that internship. So I was able to apply the things that I was already studying on my own to be able to do that. So if somebody is already a dietitian that wants to get cancer experience, what I would really recommend is if they have a current job, I mean, asking their supervisor to get some experience either in an outpatient cancer setting or getting an experience when they're inpatient in the oncology ward, that can be super helpful. But the Oncology Nutrition for Clinical Practice book is like a really great place to start. And it's the most effective way to study for what's called the CSO exam or the Certified Specialist in Oncology. But definitely have to be motivated to seek out your own opportunities if it's something that you really want to do.
I appreciate that you said the name of the book again, because I know people always say, wait, what was the name? I want to get that down. So one more time for the people who want it.
So it's Oncology Nutrition for Clinical Practice, and it comes from the Academy of Nutrition and Dietetics.
Excellent. Thank you very much. Caitlin, what about you? Any special trainings for those wanting to work with cancer patients?
You know, I really feel that cancer care sometimes sounds scary to people because you feel like you need to understand everything about the process and the treatments to be able to talk to your clients, your patients. But I think that everything that we learn is very translatable and useful. And mostly I would say grief training, and not a specific grief training because it's definitely specific to the person that you're talking to. I've seen wonderful transformations in the end of life people where they interact with their spirituality and whatever that is. And so I believe taking a very client-led approach and being comfortable talking about grief is important. And one note about that is that something that I've often heard is that people are just frustrated with everybody in their life wanting to make it positive. And that's natural, that's human. We want our loved ones to get better and to feel good. And sometimes people just need to be sad. And so being able to sit with those really hard emotions and interact with them with their specific spirituality, whatever that is important. So being comfortable with grief. I'd also recommend being really comfortable and calm and learning how to do mindfulness with clients. It really models it for them. And they can really sense it, and it is so helpful for anxiety and for pain management. So any type of training, I would say just practice. There's so many cool YouTube videos and apps where you could just turn it on and just practice doing it for 2 minutes, you know, a few times a week, and it's really easy and it's so helpful. The last one
is there any particular, sorry to interrupt, is there any particular grief training that you would recommend?
Any particular grief training? I would say, no, not off the top of my head. I think A Grief Observed is something that has hit me as a book, and often I've used for clients really well. I've also used Warden's grief model with clients. But again, I feel like a lot of people come to me and they've just, you know, they're exploring this part of their life, often when it's a terminal illness. And so they often bring me things and we go through it together. Even if it's not something that fits with my values, we explore it together and we make it work for them. So, yeah. And then I think the last thing I would say is any type of training that you can get, which is kind of a hard one to say, but where you understand the experience of physicians in the medical world. So how physicians speak, how fast their days are, and really understanding that can help you translate that to your clients and build advocacy and self-agency for them. And so that can be just consulting with other physicians, asking them explicitly, how do you want me to communicate with you? And how are you seeing the client's problems so that you can go back to your client and help them build that sense of agency. There's a book called Models of Collaboration by David Seaver and many other wonderful writers that really goes into the different kinds of settings that you could be in with healthcare and how you can collaborate with both physicians and patients that I found really helpful.
Excellent. And that book again was Models of Collaboration, right? Yeah. Excellent. Emily, what about you? Are there any special trainings that you would recommend for those wanting to work with cancer patients?
Yes, definitely. I have quite a few. Going back kind of to that question before, for those wanting to get started working with cancer patients, there's lots of CEUs, just general CEUs. You should start taking, anything related to oncology, head and neck cancer, laryngectomies. But specific courses that I would recommend is the Preparing SLPs for Tracheostomy and Ventilator Care by Dr. Jamie Fisher. The CEUs that are going to be training you in respiratory muscle strength training, also known as RMST. I'm sure lots of SLPs here, if anyone listening has heard of RMST. And then definitely getting certified in the McNeil Dysphagia Therapy Program, also known as MDTP, to treat dysphagia or swallowing problems. The Amplification, Resistance, and Kinetics of the Jaw, also known as the ARC-J program, to help treat trismus. And lastly, lymphedema therapy. So I know the Norton School has one specifically for head and neck, but you can also get certified as a certified lymphedema therapist. So yeah, there's quite a few, but I think that all of those specific ones would make a provider, another speech pathologist, and a cancer center really comfortable with sending patients to you. So
that's wonderful. Thank you. I know we are just about out of time for today. You all have had wonderful comments, suggestions, recommendations, so I'm really, really appreciative. Caitlin, Emily, Allison, thank you once again for giving us your time, your expertise today. In about 30 seconds for each of you, is there anything that we haven't covered yet today that you want to make sure people are aware of, either about kind of coming into cancer care, collaborating across disciplines, working with your discipline, anything like that that you'd like to add before we call it an afternoon? Caitlin, I'll start with you, and then Allison, and then Emily.
I would just say take care of yourself. This is really hard work, but it's important. And as I mentioned before, that illness story, try it on yourself. See how you interact with illness and how that's shown up in your life. And it'll really help you sit with those really hard sessions. So just take care of yourself, and everybody can do this. So yeah.
That message that everybody can do this, I think, it's a really important message. So I'm appreciative that you're mentioning it. It's probably worth reinforcing here. There's some reluctance among practitioners sometimes to get into this kind of care, and there's certainly ample need there. And I appreciate the reminder. Anybody can do this kind of work, and taking the recommendations we've talked about today can help people to kind of find their way in. Allison.
Yeah, I actually really want to kind of piggyback off of what Caitlin said, because I think it's important to understand how you go through your emotions as that provider, because there are some really hard things that you might experience with patients and as you develop a relationship with them, and it's a fine line of that relationship. And if you hear of someone's passing, or you hear of maybe progression in their disease, sometimes it might hit you pretty hard too, but you also have to be that strength and know that that line. So I think that's super important. But when it comes to cancer care, obviously I mentioned that's what I wanted to do. I was dead set on it. But it's also so joyful because you do get to see a lot of amazing things that happen. Even people that take their disease, their diagnosis, and turn it into this amazing thing afterwards, and they change their own life and the lives of others around them. So there's some really, really beautiful things that happen within it, although there are hard times. And then the only other thing that I wanted to interject is keep learning the people around you and your interdisciplinary team, because I couldn't imagine where my practice would be if I didn't have those individuals around me and to teach me and to grow, especially when I was a brand new dietitian. I learned so much from the other disciplines to help me in my own practice.
Thank you so much, Allison. Emily, we'll give you the last word here.
Yeah, so kind of just going off of what Allison just said, one thing I found with my practice to be, really challenging, but also extremely rewarding is looking up other providers in your area, whether it be physical therapists, dietitians, anyone in the behavioral health realm, because it will surprise you how much you can learn from each other. It will surprise you time and time again when you hear back from them and how eager they are to tell you about about what they do and how they can help your patients. And it's a lot of work, but when you finally build that team of professionals, it's very rewarding for you and your patients. So.
Well, thank all of you very much. It's been wonderful having you here with us today. As a reminder, this recording will go out to all of our registrants within about 24 hours. And on behalf of all of us here at SimplePractice, we just really appreciate all of our panelists' time and expertise. And those of you who have joined us this afternoon, we appreciate your joining us today. We look forward to seeing you again soon. Take care.